This is the healthcare delivery providers, part of the Healthcare Marketplace Specialization. This is Module 3.2.1, Long-Term Acute Care Hospital. Learning outcomes for this lecture are that we will discuss what an LTACH is, the services it provides, and also how LTACHs get paid. Long-term acute care hospitals, or sometimes called designated as long-term acute care hospitals without the A. Here's our familiar roadmap, and we are now in the post-acute arena, so we are moving here. The long-term acute care hospital is right after the short-term acute care hospital and slightly below on the cost equation, but not a lot. So this is where the LTACH sits. Here's a schematic we will be following throughout the module on post-acute care, and here's our long-term acute care hospital right after the short-term acute care hospital and before the inpatient rehabilitation facility. So long-term acute care hospitals, there's about 430 of those across the US. The average length of stay is about 25 days or above that. So patients stay for about a month in these hospitals. And as the name suggests, they take care of patients that need acute care for long periods of time. The patients typically have lots of other medical conditions, which are called comorbid conditions, and they require active physician supervision, sometimes on a daily basis. Here's how a LTACH is typically laid out. Again, very simple, similar to a hospital. The one difference is it does not typically have an emergency department. So remember that there would be no emergency department here. There would be floors of patients. So this is where maybe the lung patients go. This is where maybe the patients with infections go. And so the units are divided up. Then typically there would be a lab, there would be physical therapy, there would be x-ray, there would be administrative personnel. So again, very similar to a short-term acute care hospital, the layout is. The common conditions that LTACHs treat, overwhelmingly, it's lung diseases or respiratory conditions. So patients need help with breathing, with machines, or other illnesses. A lot of severe infections come here to LTACHs to recuperate. Ulcers of the skin and pretty large ones, and also multiple brain and spinal conditions. So neurological issues are also treated at LTACHs. Let's do a quick quiz. The payment to LTACHs is in a similar form to the payment to the short-term acute care hospitals, and it is called the Medicare Severity Long-Term Care Diagnosis Related Group. So that's a long acronym here, but it's very similar to the inpatient prospective payment system DRG methodology. So it is based upon the patient's condition, and then a bundle of money is paid to the hospital after some adjustments. So there could be a wage adjustment, there could be a high cost, a patient adjustment, or a short stay adjustment, but a very similar methodology to the PPS short-term acute care hospitals. The quality measurements for LTACHs fall under the Medicare Quality Reporting Program for LTACHs. There are many measures here. Infections are obviously counted and reported, 30-day readmissions back to the hospital, and also how many patients is the LTACH able to successfully treat and transition to the community, and functional assessment and outcome measures. So did the patient actually improve in function as a result of being at the LTACH? One of the things that we will talk about more in the upcoming lectures is this emerging tool called the Continuity Assessment Record and Evaluation Tool. And the basic point here is that hospital and all of these post-acute care facilities, the same patient is flowing, and all of these facilities do their own assessments. So this particular tool is thinking about doing the same assessment and same tool throughout the care journey, so you can compare, is the patient getting better or worse throughout his or her journey. So here's a quick schematic of what the role of an LTAC is. So here's is the community hospital, and most of the patients from the community hospital will be discharged home. Some of the patients from the community hospital will need post-acute care in a skilled nursing facility, and the sickest of the sick patients will need to go to a specialized facility to continue acute care, and that's where the long-term acute care hospital comes in. So it's a very small percentage of patients that need to stay at acute care level of care, and those go to an LTAC. So in summary, LTACs are highly specialized delivery providers that service acutely ill patients for a long period of time. The LTAC model, the reporting, the quality measurement is undergoing active transformation and debate. And one of the main reasons, obviously, is because of the very high cost of LTAC services.